Went from being a football hero to a murder suspect. O.J. Simpson died at the age of 76 after a battle with cancer. The former professional football star, who was acquitted of murdering his former wife and her friend, reportedly was being treated for prostate cancer. In May 2023, Simpson posted on X, it was known as Twitter then, that he recently caught cancer and had to do the whole chemo thing. He added, it looked like I beat it. Then in February of this year, it was revealed Simpson was beginning chemo again for prostate cancer. Joining me on the morning show is Dr. Ali Kasraeian, fellowship-trained urologist with Kasraeian Urology. Hey, good morning. Thanks for being here.
Good morning.
So with early-stage prostate cancer, almost 100% will survive 5 years or more. But men with advanced prostate cancer, or if it's spread to other regions, survival rate is less. Well, we don't know Simpson's situation for sure. There are some things to be gleaned from his death.
Absolutely. I think the big thing to take away from this is early detection of prostate cancer is key. And the challenge and the thing that we talk about over and over again with prostate cancer is talk to your doctor, and it starts with your primary care doctor and being your own best advocate about screening and appropriate screening and smart screening. Talk to your doctor about screening for prostate cancer. Starts with an easy, inexpensive lab test called the prostate-specific antigen, the PSA test, and an rectal exam. And even that has controversy in the data, but those are the two best things that you can do to check for prostate cancer. But that lab test is a great thing to do to start early. Two big risk factors. Family history, especially first-degree relatives like a father or a brother, increase your risk of prostate cancer significantly. And being African-American or of African descent, for multifactorial reasons that we don't quite understand, increases your risk of prostate cancer.
I want to get to that in a second. Let's talk about the screening. Unfortunately,
Sure.
Research shows that black men are less likely to receive prostate cancer screening than white men. I mean, that's just a fact.
Yeah, and we try to look at that. The state of Florida has multiple committees that we look at that to try to improve that. And the social determinants of health, racial disparities exist. And so that even increases the importance of talking to each other and talking to the men in your life, especially in the African-American communities, to make sure that we screen and we screen early. Right now, with the guidelines, the American Urological Association guidelines talk about African-American men and men with a family history, especially African-American men with a family history, start screening at 40. And men with no family history and normal risk categories start at around 45.
So let me look at some numbers here. Like many
Sure.
other types of cancer, prostate cancer has a significant impact on black communities. Numbers shine a harsh light on racial disparities. Prostate cancer makes up roughly 37% of all newly diagnosed cancer cases in black men. And black men get prostate cancer at a younger age than men from other groups, and they are more likely to have advanced disease when they are diagnosed. Is that because of genetics?
So it's multifactorial. There are genetic issues, there are environmental issues, there are situational issues, the social determinants of health make that we don't quite understand, which makes it even more important to take that out of consideration. So the idea with this is if you're going to have a prostate cancer that could potentially be more aggressive, it could potentially be more fatal, could we potentially equalize that factor and find it earlier, where it's going to be in this earlier stages, it's going to be a lower volume, so that our treatments are going to be more effective and less invasive and allow you those cure rates where localized prostate cancer and even regionally advanced prostate cancer, meaning it's only kind of pushing out of the prostate a bit, or even the local lymph nodes within the pelvis, approach 100% cure rate.
All right, so the problem is often there are no signs. But if something were to manifest itself, what would be something to tell a guy that, look, maybe you should get it checked?
So the thing that if there's anything to take away from this, and people go on the internet, they look at things, people talk about this, the signs and symptoms of prostate cancer. Most prostate cancer is completely asymptomatic. The reason we see patients in the clinic to get diagnosed with prostate cancer as urologists is often they come to clinic for a second opinion or an opinion from a primary care doctor because they have an elevated PSA test. Very much more rarely is it because there's an abnormality on a rectal exam where their prostate has a nodule or a bump associated with that elevated PSA, or often it may be completely unrelated to that. The PSA test is the hallmark of prostate cancer screening, and that's the important thing to take away from this, is talk to your doctor about a personalized screening regimen that meets your risk factors, and that is the way to help avoid having aggressive metastatic prostate cancer that will leave you in a situation that you are from that. And sometimes this is not people's fault. People do appropriate screening and they have an aggressive prostate cancer that even when they do the right thing, it becomes aggressive. But when we catch things early, we have better and better medications these days than we did even a few years ago that can have better outcomes. So early detection is key, and honestly, it can save your life when you have a cancer that's more aggressive. And now we have the genetic testing that we can do to give us information to help guide us. Talk to your doctor about prostate cancer screening and early screening, especially if you're of African American ancestry and if you have a family history of prostate cancer.
And the treatments today are a lot less invasive than they used to be, and we know that guys don't like to go to the doctor. And
Last takeaway from this with that, where people are afraid of screening and the implications of treatment, most of the new things we're doing, MRI scans, biomarkers, the inherent design of these tests are to avoid unnecessary screening. So we're not looking to create assembly lines of biopsies. One, biopsies are much less invasive. We use things to make it more comfortable, and people do great with them in terms of tolerance. The other thing is when we do biopsies to look at targeted lesions, it allows us to consider things like focal therapy. If you have an area that we can target, if that's the only area that has cancer, if we can treat that, the more prostate you preserve, the more function you preserve. So the quality of life is a big important factor for us in terms of how we manage prostate cancer. And a large number of prostate cancers that are low risk, we can just monitor with active surveillance. So don't let the fear of the therapy avoid the power of screening that could actually save your life and avoid this very unfortunate situation where an almost 100% curative disease becomes fatal.
So I've talked with Dr. Ali so many times. What he's really saying is don't go in assuming, oh, I'm going to be incontinent, not going to be able to get an erection, or going to wind up with a bag. Dr. Kasraeian, thanks very much for being here. Appreciate it.
Thank you for having me.